I have that it's 2:20. So if we have everybody back, I will introduce our next speaker. We have a presentation now by two speakers, Nayamin Martinez and Gina Solomon. So I want to introduce each and then we will get to hear from them. Nayamin Martinez is the director of the Central California Environmental Justice Network, or CCEJN. Prior to joining CCEJN, Ms. Martinez worked for the Madera County Public Health Department as a health education coordinator, and for 10 years was the health projects coordinator for the Binational Center for the Development of Oaxacan Indigenous Communities. Ms. Martinez has vast experience working with immigrants and residents of disadvantaged communities across the San Joaquin Valley, managing public health programs, conducting participatory research, and launching leadership and civic engagement programs. She holds master's degrees in both public health and sociology. Our second speaker is Gina Solomon, who's a principal investigator at the Public Health Institute, where she directs the Science for Toxics Exposure Prevention STEP program and the Achieving Resilient Communities ARC project. Her work focuses on anticipating, preventing, and responding to climate change impacts in the most impacted communities in California. She's also a clinical professor of medicine at the University of California, San Francisco. So Nayamin and Gina will be presenting on their plans for the FRESSCA-Mujeres project, which will include an intervention component to protect farm workers in the Central Valley from wildfire smoke.
Thank you for the invitation to present. It's a pleasure to be here with you. Gina and I will be sharing roles here in presenting, and I'll start with the first set of slides. So next slide, please. We just want to say that the PowerPoint that we have developed together reflects it's through a grant that we received from the US EPA, but it has not been reviewed by EPA. The views expressed in this document only are from Gina Solomon and myself, and do not reflect necessarily those of the agency. EPA does not endorse any products or commercial services. So thank you, Gina. Next one. I will skip this slide because you already have a very thorough explanation of myself and my background. And I'll just jump ahead and describe why the Central Valley. Many of you have been probably very familiar with the Valley, but I want to point out some of the major sources of pollution, especially air pollution, that are of concern to us in this study, but to the Central Valley residents in general. The organization that I have the privilege of representing has worked for 22 years advancing health equity and environmental justice. And the reason why is because of why all the problems that we have in the Central Valley. Most of the environmental problems that our communities face are byproducts or the main economic industries that we have. Starting from the left to the right, on the left, you have agriculture. Agriculture is perhaps the main economic engine across the 8 counties, but along with that comes all the byproducts of the uses of fertilizers, pesticides, that are not only polluting the air, but also the water. Pesticides continue to be a very significant concern for community members, not only those who work in the fields, but also those who live close to the fields, especially those that have not adequate weatherization and filtration in their homes. And that's something that part of our project would be addressing. The second major concern that we have, it's in the reflected in the middle picture, and that is all the industrial facilities. We have some of the more active biomass facilities in the state are still active in our region, producing significant amounts of PM 2.5. And just to highlight that the Central Valley has the worst quality in the nation, we are in non-severe attainment for PM 2.5. And the other big culprit of that is also the oil industry. Kern County, the southern part of the Central Valley, is the place where 80% of the oil extraction that happens in our state take place. Again, having significant impacts on the air and the water and the lives of the residents of disadvantaged communities. And although we don't have a picture for that, but one other thing that I just want to mention before I jump into talking more about CCJN is that in the last 5 to 8 years, all the counties across the San Joaquin Valley had turned into the approval and placement of massive warehouses and distribution centers as an economic engine for a region, causing an increase in diesel pollution in our area as well. Next. So in a nutshell, CCJN, as I said, has been active for over 20 years. At the beginning, we just only focus on organizing conferences where activists and people concerned with environmental injustices came together. But over the years, in 2013, the organization finally transitioned from being a volunteer-run organization to becoming an organization with paid staff. We have offices in Bakersfield and Fresno, but we operate programs in Madera, Fresno, Kings, Tulare, and Kern counties. As of now, one other major milestone that our organization was able to achieve just this year was becoming an independent nonprofit. But as I was saying, since 2013, we were able to have paid staff implementing projects addressing the major environmental concerns of our region, including air pollution, pesticide exposure, water scarcity, and water contamination. And of course, oil and gas as well, especially our work in Kern County is heavily focused on this issue. Next. One of the programs that we most recently launched, and I would have to say that this was really a result of something that we did during the pandemic. In the middle of, when everybody was sheltering at home, we were forced in a way, or not forced, but motivated to help farm workers because they were considered essential workers, yet they were working in unsafe conditions. And oftentimes we realized that they were not aware about how all the multiple exposures that they were affecting their health that go beyond pesticides. A lot of unsafe conditions in the workplace. The wildfire smoke definitely had been affecting them. In 2020, when we were distributing masks for the pandemic, that was not the only reason. It was also the N95 masks that were needed to shelter them from the smoke of wildfires that affected our region. So one of the goals of this project is really to improve the ability of farm workers, but also residents of rural communities to understand and to be able to identify and monitor pesticide exposure, but also other forms of exposure that affects them. And based on the data that they're collecting, they transform that data into advocacy campaigns targeting the agencies or the decision makers that are able to impact and change these conditions. Next. So one of the things that we have been doing since 2014 is community air monitoring network that we have been developing. Why? Because we realized that there were only over 30 regulatory monitors across the 8 counties. That did not give us real data of what was the local air quality in our communities. Therefore, we did not know what our communities were breathing, what were affecting their health. So through a variety of methodologies that included stationary monitors, local sensors such as purple air, the DILOs that measure PM 2.5, but we also have been able to engage residents, training them on how to collect grab samples to measure VOCs. In 2019 and 2012, while doing these efforts of educating residents about air pollution, showing them how to access data from these local sensors, we hear loud and clear a concern that community members have about their exposure to air pollution inside their homes because they live in homes with evaporative coolers or swamp coolers. We turn around, as we always do, and transform those concerns into opportunities for changes and improvements. In this case, we approach the Public Health Institute, and in partnership with Dr. Solomon and others in the Institute, that's how the project FRESSCA was created. And then a spin of that is the FRESSCA-Mujeres project that we'll be describing, or Gina will be describing in a minute. So basically, the goal of our project is to reduce wildfire smoke exposures by designing, testing, and deploying an affordable and effective filtration system for homes that have swamp coolers. And this is a picture of how a swamp cooler looks like. Next. We have 2 study locations. In Fresno County, in this particular county, we have 3 communities. Right now, we have been already deploying in this first year the pilot of we have deployed monitors in Coalinga, and in the future, in the subsequent years, we're also going to add the communities of Huron and Avenel. In Kern County, we have already incorporated or engaged and recruited residents in Arvin and Lamont. Arvin is a small city in the southern part of the county, and Lamont is an unincorporated community. So the common denominator among these 5 is that they are mostly farm working communities, communities with the majority of the population being Latinos, immigrants, farm workers. Next. And this is where I'll turn it over to Gina.
Great, thanks, Nayamin. So the FRESSCA study, we realized that if we were going to tackle to reduce exposure to smoke inside people's homes that was getting pulled in by their swamp coolers, we needed some engineers. So we reached out to some folks and partnered with engineers at Illinois Tech. Seems like maybe an odd group to partner with, but they're actually fantastic and have a lot of relevant expertise and experience. And they actually purchased several swamp coolers and have been outfitting them in their laboratory. And as you can see here, there's on the right an actual photo of a swamp cooler with the sides taken off. So it looks kind of like the one that Nayamin already showed, but the exterior the sides are removed. And you can see it's just a very simple machine. It's just basically a fan and a blower driven by a small motor. And then there's water in the bottom of it that gets pulled up, wicked up into pads. And then when air from outside is pulled through those pads, it cools it and humidifies it a little bit. They're very energy efficient and very affordable, which is why they're common. They are unfortunately a bit water wasting, which is a drawback. And the other drawback is that it turns out that those pads, the wet pads actually don't really reduce particulate matter. So most of the PM in the outdoor air, as well as many other contaminants, get pulled in. And since the fan and the blower are quite strong, it really pushes contaminants right into the home. It's a concern that's the concern we're trying to address. Well, let's see if I can advance this. There, okay. So the team was actually inspired by the Corsi Rosenthal box, which is some of you may be familiar with. It's very low cost, do-it-yourself solution to air quality. It's turns out that these are just about as effective or even more effective than expensive air purifiers. They're not quite as pretty, but they work well. And it's a box fan, standard box fan, and then 5 air filters, basically, sort of like furnace filters, duct taped together to make a box. The downside, and you can see this on the lower right, is that they bring in a lot of clean air. Their clean air delivery rate beats most air cleaners, but they're quite noisy. So sometimes people don't like to use them, but we were sort of testing against these. And so the proposed solution for the swamp coolers is actually just to basically bungee cord filters, MERV 13 filters to the exterior, and on each side of the swamp cooler, and those will filter the incoming air, and it tests out extremely well in the laboratory, and then we tested it out. This shows it, what they did in the laboratory in terms of particle removal efficiency, which is quite good. And then we went to the two areas that Nayamin pointed out in Fresno County and Kern County, and worked with CCJN, recruited 30 homes this past summer, and did pilot testing in those homes to show, to demonstrate, the potential for the project to work. So we kicked off with community meetings in each town in April, and then again went back for community meetings in October. We divided up the homes. We actually intended to randomize, but it turned out that we couldn't randomize because the design was such that there were some homes that we couldn't outfit with the swamp cooler filters. So we ended up then randomizing those to either a commercial air purifier or a box fan filter. And we installed, you can see here, Ruben from CCJN on the upper left, installing a purple air monitor outside a home. We also installed them inside every home. And Gustavo and Gabi from CCJN in Kern County on the right at a home where they're looking at the swamp cooler filters that had just been installed, and some community, one of the community meetings we had in Coalinga. We pilot tested our questionnaires, and we also used different types, tested out different kinds of data loggers so that we would know when people were running their swamp coolers and the other equipment versus not running them. And then this shows the solutions that we tested out: the swamp cooler filter, Load 300 air cleaner, and then a box fan filter. We tested out actually a couple things. We tried the big Corsi Rosenthal boxes, but many of the homes in our study were very small. Many were about 900 square feet. Many were manufactured or mobile homes. And so those big Corsi Rosenthal boxes were too big to accommodate inside the home. So we were using a different solution that was suggested by some of our colleagues at US EPA. Gives you a sense of the numbers in each category for this past summer. And just to give you a little bit of a sense of the participants, really everybody completed their consents and their questionnaires in Spanish. Most of them felt most comfortable doing it verbally in a face-to-face interview. Almost 80% worked in agriculture, either as farm workers directly or in food processing or some aspect of agriculture. The rest, construction, some other things, home health were a few folks. And then people obviously did not have HVAC systems. Some of them had both a swamp cooler and a wind air conditioner in a bedroom, but the cooling was really by swamp coolers. And then you can see here more than half were either a mobile home or a prefab home, and minority were lived in constructed homes. So we're still analyzing we have huge amounts of data from this past summer. We're in the thick right now of analyzing everything we've got and redesigning, tweaking, reevaluating the questionnaires and so forth. We're going to be refining the protocols and then launching again in the spring to do more homes next summer. We did get an additional grant. You can see here from the bottom from the California Breast Cancer Research Program to add an element to this study. So instead of just indoor and outdoor air monitoring, we will now, in the FRESSCA-Mujeres study, be looking at some indicators that are related to health. So we're going to be focusing on farm worker women in the homes. We'll be looking at biomarkers in urine of oxidative stress and inflammation done through a lab at NYU in New York. We'll be looking at those at 2 time points. One is in the sort of late spring, early summer before the wildfire season, and then again in the late summer or fall time period as during the wildfire season. We'll see. I mean, we don't know if there will be a wildfire, so that's always a question mark. We'll also be collecting saliva samples for analysis at the Blackburn lab at USF for a measure. We were sort of interested in this issue of cumulative impacts, biological stressors from both environmental and social stressors. And so we're looking at telomere length in this population because that has not been collected. And that's basically, as you may know, that telomeres are basically the caps at the end of people's chromosomes. Those shorten with age and shorten at a faster rate in some people than others, which has partially to do with genetics, but a lot to do with the environment and the stressors in people's lives. And the shortening of telomeres, once they get too short, the cell can no longer divide. So there are associations with multiple different health endpoints. So we also have some elements, really social elements to this study. We're working with an entity called Story Center in Berkeley. They do storytelling workshops in communities, and we'll be doing these in both communities to do digital stories of farm worker women to talk about smoke exposure, breast cancer concerns, and general health concerns in their communities. And so we're looking forward to collecting both quantitative information and also qualitative information as part of this FRESSCA-Mujeres study. So we will be over recruiting a little bit. As you may have noticed on a previous slide, we did lose some homes in our pilot study. So that gave us a sense of the attrition rate. The reason we had some attrition this past summer, one participant moved, and then 3 participants unfortunately had their swamp coolers break. These machines are not super reliable. They do break down sometimes, and in some cases they just decided to manage with window air conditioners instead. So we lost some homes. So we'll be recruiting 58 participant homes this summer, approximately, in the hopes of ending up with at least 50. We'll be focusing on homes of where nobody smokes in the home. Everybody has an evaporative cooler. Where there are women agricultural workers in the homes. We'll be testing a filter on the swamp cooler, the evaporative cooler, versus another intervention. And we're actually trying right now to see which of the two, the box fan or the commercial air cleaner, is the best to use next summer. We're not going to be testing both, as our power calculations indicate that we won't really be able to have a 3-arm study. We'll be asking a lot of questions about household and occupation, respiratory symptoms, breast cancer risk, and information about what people know about wildfire smoke hazards. We'll be doing purple air monitoring, and then very extensive indoor and outdoor testing if there's a smoke event, including for volatile organic compounds, PAHs, metals, deposition testing for particulate matter, in addition to the testing that we're doing with the purple airs. And then I think I saw Jeff Wagner's on this call. He's going to be doing some detailed characterization of the particulate matter and and the pH testing as part of this study. He's part of the current FRESSCA and the FRESSCA-Mujeres study. So there's, and I know he's also very involved with Biomonitoring California. He's a good bridge. So this gives you a sense of a potential biomonitoring component. So we've been working with OEHHA to think about, since we're already going to be in the field, we're already going to be doing urine sampling in the spring and in the late summer, fall. And we were already planning to do one sample at each time point, but we could, it's not that hard to do additional urine samples. So we're looking at adding some additional urine samples for biomonitoring. In particular, there are different ways we could do this, but we're thinking about doing a morning and evening sample to capture, since these are farm workers, they will have outdoor exposures in the fields at work during the day. And then we hope there might be some recovery time at night with the benefit of the indoor air quality filtration. So if the filtration works, it will basically be reducing people's exposure from a 24/7 kind of situation to significantly less than that. And we may be able to pick that up with biomonitoring. We're looking at or talking about potentially including pHs, VOCs, and some metals that are associated with wildfire smoke, but we're interested in input on that. The pHs, I think, are the most definitive as clearly linked to wildfire smoke exposures. So some of the questions that we have for the SGP, we'd love to put on, since we're right now in the process of putting together the protocols for next summer. We're a little, recruitment could be a challenge. We're looking for certain types of swamp coolers that we know that can fit with filters. We're looking at people who work as farm workers or maybe just outdoor workers in some cases. Would that be a feasible option to broaden recruitment? And then should we be looking at doing sort of spring and fall sample collection, or another alternative would be sampling just before we install the filters, and then shortly after the new filters are installed in people's homes. And then we're also struggling right now to develop all the questionnaires, lots of things that might be relevant to ask, but we're always interested in input on specific questions that might be helpful to ask in this population. So I think that's the presentation. I did want to thank our project team. So I've mentioned, I'm with the Public Health Institute. We also have folks from Tracking California, Paul English and his team, who are also with Public Health Institute. A large team from CCEJN, a great group from Illinois Institute of Technology, Jeff Wagner as well from CDPH. Kazu Kumagai has also been an advisor to the project. And then a number of other technical advisors, John Baum, Shelley Miller, Brett Singer, advising on different aspects of the project. And now Biomonitoring California and UCSF, some additional UCSF folks, Peggy Reynolds and her team on the biomonitoring piece. So it's a great group and it just seems to keep growing. I just want to make a plug for Kern County. There is a truck parked in Lamont that has the best raspados that I have ever tasted in my life. So if you're ever down in Lamont and want to enjoy the most wonderful fruit, tamarind, and chili drink you've ever tasted, fruit mango chili tamarind drink you've ever tasted. It's worth the journey. So that's all, and I will stop sharing and be happy to take questions.
Great. Thank you both, Gina and Nayamin, for that presentation. It's a super exciting project. We have 10 minutes now for clarifying questions from both the panel and the audience, and then we'll have a half-hour discussion, open discussion. So Tom. You're muted, Tom.
Yeah, sorry. Now I'm off mute, right?
Yes.
Okay. Fascinating project. I just want to congratulate all of you on it's just a great team. You know, your partners on the air filters are great. You know, getting advice from someone like Brett Singer, who I've worked with for years. He really knows what he's doing on filtering. I guess there are some technical questions, and I have some thoughts about your questionnaires, but I think I'll hold that off maybe to, we're going to have a deeper discussion later on. This is more clarifying, right?
Yes, that's right.
So I'm not going to
questions
offer
now.
my comments yet about what might be in a questionnaire or could, but I guess what I was curious about first in developing the filter system for the swamp coolers. I mean, you settled on a MERV 13, and there's definitely an advantage of 13 over 11, and we saw that in the figure. I don't know if you want to bring that back up, but then there's also like MERV now 14. There's MERV 16s, and I know. I mean, I did something similar in my own house with a whole house. We have a furnace with a filter slot, but you know, was there a question about how to optimize the filters to not like put too much stress, you know, on the swamp cooler, but also get effective cleaning? Or was it just that you pretty much thought MERV 13 was probably the way to go?
No, that's a great question, and I didn't want to get detailed with the filters, but it totally makes sense. And by the way, Brett has been amazing, and he was the one who introduced us to the IIT team in Illinois. And the team tested out a lot of different filters on these swamp coolers. They purchased 2 models for work in the lab that represented a bit over 50% of what we found out there in the communities on a survey. And they tested out filters that would have been, I can't remember whether, I think they did go up to MERV 16. And unfortunately, the motors on these swamp coolers and the fans the blowers are not that powerful. And so what was happening was it was really choking off the swamp coolers, and the flow just tanked. And so they had to balance it. And the problem with the MERV 13 that we're struggling with right now is that there is in the smallest particle sizes, which is what you expect, there is actually a fair amount of particulate matter that gets through. So they're not perfect. We're actually in a conversation right now in the team about whether we want to stack interventions. You know, basically, have the filters on the swamp coolers and also have an air cleaner inside the home to basically, this is Brett Singer's suggestion. Yeah. And we're checking out our bit to see if we could make that work. I think it might be optimal. We also were trying to think about affordability. We ended up using Rent's 4-inch thick filters with carbon so that, you know, to attempt to capture VOCs in addition to trying to capture particulate matter. We heard from Nayamin and the other CCJN team, and you heard this too, concerns about pesticides. All the photos Nayamin showed of the other pollution sources were taken from the backyards of people's homes who are enrolled in this study. So they're, you know, these are very real other exposures, and so we're trying to see if we could reduce VOCs and PM. But yeah, it's a challenge.
Well, just to respond, it's a data point of one, but I have a purple air indoors and outdoors, and I have a whole house 4-inch MERV 13 on our furnace, and we can run it in fan mode. During the worst fires, we saw an enormous reduction. We were getting 60, the air quality index would be 120 outside here. I mean, this is in Albany, the Berkeley area. And indoors, we were down in the 70s. I mean, we were getting phenomenal reductions with just one whole house MERV 4-inch MERV 13 running on a whole house fan. So I mean, that again, that's a data point of one, but they're pretty effective. And we have the same problem. I mean, we couldn't go to a 16 for our house because it would be too much stress on the fan motor for the furnace.
I think one other positive thing just to toss in is that when you run a furnace filter, there's always the concern about intrusion through cracks because most houses are negatively pressurized, and so outdoor air just sort of leaks in. The nice thing about a swamp cooler is since it pushes so much air in through the swamp cooler, the houses are positively pressurized, and we tested that, and really it was true in all homes. So in other words, air is going out through any cracks. What that means is if you can filter the air coming in through the swamp cooler, smoke is not going to get in through other cracks and crevices.
Yeah. All right. Well, thank you very much. You addressed but I have more issues we'll bring up later when we have more time for discussion, particularly on the questionnaire. You wanted some input on questionnaire. Okay, thanks.
Yeah, so questions for now, and then we have plenty of time for discussion. Jenny.
Hi, thank you, Nayamin and Gina, for a great presentation about a great study. Since these individuals participating sounds like quite often working in the fields, the open fields during the day, are they counseled to wear masks? I know it's very hot to wear that, or is there any kind of protection they could put on during the day since they're so exposed outside to the wildfire smoke?
That is a program or a campaign that we have implemented, an educational campaign along with distribution of A95 masks. In the year of the pandemic, we were just distributing COVID relief cash assistance, and we were asking, do you receive this? Because you have the right, the obligation of the employers to give you this because air quality is hazardous, blah, blah, blah. And the response of almost everybody was like, no, I have not received one. So that's how we started. Not only we surveyed 201 farm workers, and then based on that, we did like a little intervention. We have a wallet card that is in Spanish and has a lot of visuals and has the employer obligation, what the air quality is, and how to go and check it out. We help them register to receive text alerts so that they could know when the air quality is bad, and then we give them the N95 mask. However, the flip side of that is that they have told us that although they understand that they need this for their protection, it is very uncomfortable and that they feel they are choking because the wildfires can happen here in the valley when we have the heat as well. So imagine wearing an N95 mask, trying to do physical activity and in 100+ degrees. So people definitely are struggling to follow the advice, although they know this is for their protection. Is really, it's really difficult to follow. And some frankly told me, you know what, I won't wear it because especially those that are working by contract, they get paid the more that they work, and wearing the mask, they had to stop to take breaks and it was kind of slowing them down. So that's the struggle that right now we are following between what the best practice should be and what the reality of its applicability is on the ground.
Yeah, they really need a supplied air hood. They're trying to get some very low-cost ones in the medical field. Actually, they're trying to work on these very low-cost supplied air things that don't make it so hard to breathe,
Well, but, either that or really not working and being able to stay, indoors or, but then the problem is, how are they going to pay the bills? If they don't work, they don't get paid. So it's not an easy solution.
And I'm just curious, are you collecting house dust as part of this study? Because it's a very interesting kind of record of pollution in the home.
We don't have a plan right now to collect house dust, though it's funny you should ask, because we've actually, Nayamin and I had a conversation about that, and we're trying to, yeah, we could always collect it and then save it for potential future analysis. So thank you for that suggestion. We'll look into that more.
And my very last question, I'm just curious if there's commonly children in the home or not, because that would be another highly exposed population that if you're getting urine samples, maybe something to think about. Also collecting those samples. Thank you.
There are children in many of the homes, not all, but this study is focused on women, and you know, because of the funding from the California Breast Cancer Research Program, we're really focused on women farm workers. We don't have, we haven't gone to our IRB to seek permission to recruit children. So thanks for that suggestion. It is something to think about.
They're baby women, some of them. So.
Jose.
Yeah, a very nice presentation. So you're interested in testing this intervention, and you're still tailoring a little bit what the final intervention is going to look like. And so you're looking at 58 participants. Is this going to be a 50-50 split of the intervention, or what are you envisioning?
Yes, possibly. We may have, we may more like 30-20, really trying to get a feel for that, the swamp cooler filters. So if we could outfit, you know, more than half, we will. We've had some issues with swamp coolers are complicated. I had no idea. So it turns out they come in a lot of different shapes and sizes. And so I mentioned that our team has figured out strategies that work for, you know, more than 50% of the side-mounted swamp coolers that are out there, but there's a lot of different types. And so if we have trouble recruiting and we end up with some that we can't use, we'll have to put those in a control arm. And so that may determine how.
And your thought for the control arm would be...
And then in some cases, people, like the swamp cooler breaks, they buy another one. It's a different type.
Oh, yeah. Well, I guess two follow-up questions with that. So one of them, so you mentioned that there were a couple of participants whose swamp coolers died. Was that kind of as a result of the filter, you think? Was there something of that sort? Do you have any thoughts in that regard?
One of the more ones where we had put the filters on. In a couple of cases, the swamp coolers broke before after we had recruited the participants in April, but before we outfitted their homes, which was in July. And then in a couple cases, they were control homes. So, you know, none of them had filters on them. So we don't think we actually damaged any swamp coolers in our study, fortunately.
Okay, that's good. And so I guess I have a question about, so you're doing some biomonitoring, you're collecting urine only, I believe, right?
Yes, that's correct. And saliva for the telomere length.
Okay. And so then I'm just looking at your question for the SGP about the timing of these collections versus one would be seasonal versus pre-post filter installation. I don't know if this is a good time to have a discussion about that, or if I should hold off to that until.
No, I think we're just going to do clarifying questions now, and we have a good chunk for discussion.
Okay.
Thank you.
Okay, so then my final question is, okay, so I mean, you're still working on what the control intervention would look like, it sounds like, and it will be something that's beneficial, but you're still working things. Okay, so I don't have too much.
Yeah, we're open to advice on that. Part of the trade-off is the participants really like the commercial air cleaner, the Levoits that we used. They, they're nice looking, they're quiet. They definitely, for the most part, tended to just use them and leave them running, which was nice. The box fan filters sometimes ended up in a closet or not used very frequently, though that would probably change if it was really smoky. The box fan filters are obviously much more affordable, so we could, purchase those for every home if we wanted to without too much difficulty. So we're weighing the trade-offs there with the interventions. And the box is so far from the preliminary data, it actually looks like the homes that use the box fan filters, the air quality actually looked a bit better. I mean, it really, they seem to work extremely well.
Thank you.
Ulrika.
Thank you. Thank you. That's such a great study, and thank you for a wonderful presentation, both of you. I have a couple of questions about the swamp coolers, which is probably just related to my ignorance about swamp coolers, but you mentioned the pads. Do they have to be changed regularly? Yes.
They have to be changed every year. And so one of the things that we have as part of the study, I probably should have mentioned it, is we're offering that as a free service to all of the study participants, regardless of whether they're in the control arm or the study arm. And so we contracted with HVAC companies in each of our study locations to go professionally service the swamp coolers, which involves a number of different things, and cleaning them, changing out the water, making sure the pump works well, and changing the pads. Yeah, that's all important. Though we actually had trouble with some of the HVAC companies, so we're struggling with getting this done, and hopefully enough. But we're planning to do it in some form next year as well.
And then, so kind of a related question, I think about wet pads. I'm not sure exactly what the material is, but I mean, do they have problems with mold? Which is obviously another air contaminant.
The most common kind of pad is aspen. And it's sort of a woven wood, basically, shredded material. Though some have cardboard, and then some have this sort of blue, I don't know what they're made of, but they're some kind of synthetic pad. So there are multiple different pads out there on the market. I don't know about mold growth on the pads, but we're very concerned about mold growth on our filter interventions. So for that reason, when we collected the filters from the homes, they're now one filter from each of our participant homes is now in Jeff Wagner's lab. And he's going to be doing microscopy to evaluate what's on that filter, and that will include looking for evidence of mold growth. There was some dampness of some of the filters, and we just want to make sure we're not creating a problem.
That's great. And my last question is the questionnaires on it. Maybe you said this and I missed it, but is it going to be one time, or are you going to do them, like in each, sampling window? Have you decided that yet? Maybe you're still thinking about it.
So what we did this past summer was one set of questionnaires in late April, beginning of May, when we recruited the participants, and another set the first week of October when we removed our study interventions, the filters and so forth. And then in the interim during the summer, we did periodic, very short sort of check-in questionnaires. We're the Biomonitoring California team pointed out to me that we'll need to actually ask biomonitoring relevant questions at the time periods when we collect the urine samples. So we're gonna rethink the timing of our questionnaires and which we do when. It's probably a good thing because when you stack all those questions on at once, it can become a pretty long interview. And so it may work better to have different questionnaires at different time periods.
Thanks.
But
That was
yeah, and we're open to, yeah, we're working that out. Any input you have on that would be welcome.
thanks.
I just want to note that we have until 3:30 for our discussion. And so that's just 20 minutes from now. So maybe we could keep the questions kind of focused and leave enough time to provide the study team with some input. Jose.
I forgot to lower my hand from earlier.
Okay, thanks. Unha.
Yeah, my question is going to be quick. Just clarification about you mentioned that you are going to test the VOCs and pHs metals, and can you just clarify which samples you are going to measure them? And then in your questionnaire, is there any question about kind of noise kind of concerns, anything like that?
Yeah, so on noise, we actually ask a set of questions at the beginning and the end of the study. Currently, again, this was our pilot year and we were testing out questions. So we'll be making some refinements, but we ask about what people, about concerns people have about their indoor and outdoor air quality. And then we ask them about whether they like their cooling system and what, if they don't, what issues bother them. And noise is one of the questions there, but we will definitely need to ask a bit more about that, I think. And then in terms of the sampling, so there's the environmental sampling. And Jeff, since you're, I don't know if you want to talk a little bit about what you're planning. The environmental sampling is largely going to be triggered by a wildfire event. If we have a smoke event, we're going to be out there doing pretty intensive sampling to collect material. And Jeff, I'll let you talk about that a little.
Sure. Yeah, thanks. We are definitely still in the planning phase as far as the details of particularly flow rates and sample durations, which will be important. But the current plan is to use sorbent tubes for gas phase VOCs and mixed cellulose ester filters for metal analysis.
Great, thank you, Jenny.
I'll try to be very quick. And this is really a clarification question. So it sounded like you're taking away your intervention, you just said, so you're going to remove your intervention. I'm just wondering why you would remove it and not try to leave your intervention there and leave the purple air and things like that. And then my second question is, I thought there was not a control per se. I thought there was just going to be before and after the intervention, but maybe then you kept using the word control. So do you have controls not getting anything? And if so, why? Why wouldn't you just have a delayed onset getting the intervention?
I'm so sorry. Yeah, that was unclear. What I'm calling controls are the ones that don't have the swamp cooler filters, but instead either the air purifier or the box fan.
That's what I thought. Okay.
We don't have a no intervention control. We did end up having 2 homes with no intervention this summer because we had set them up with purple airs, and then they, for a variety of reasons, they either didn't use the box fan at all, or in one other home, we just weren't able to install anything, but we had the purple air data. So we ended up with 2 homes with no intervention. That was not intentional, to be honest. And this coming summer, yeah, that we'll have data pre and post installation of the filters. So wait, let's see. So your other question was about, I'm sorry.
Why you would remove, did you say
why
you were
would
going to
we-
remove your intervention?
Yes.
Why wouldn't you leave everything in place? Or
Yeah. So in the fall, people stop using their swamp coolers. They turn them off. They usually drain the water and cover them. And so the filters really have to come off. And in addition, we discovered that, time the filters start to degrade. There's sunlight, there's dust. There was it starts to rain. And so for all of those reasons, we can't leave those filters on. The purple airs, the EPA requires a lot of quality assurance of their grantees. And so we actually did pull back the purple after this summer to do to do testing to make sure that they are ready for field deployment again next summer. We only pulled back the indoor air purple airs, and the outdoors are gifts to the community. So we have 3 outdoor purple airs installed with the data, publicly available in each of our study communities. But yeah, so afterward, I don't know if people will want to keep the indoor purple airs, but we would offer it to folks if they want at the end of the study. We also are not sure if the participants from next year will be enrolled again this year. It was a 1-year consent, and we're going to be going back and reconsenting and for year 2. And then
what about the
Lavoie,
filtration, the air filters?
The Lavoie and box
Yeah.
fan filters, we are giving those to the participants who were assigned those.
Okay. Great.
We're replacing the filters because in most cases they were pretty dirty. So we pulled them back to the CCEJN offices. We are swapping out the filters and then giving them back to those folks.
Thank you.
Great. I just want to check in with Cheryl for a moment to see if there's any questions that we need to highlight from webinar attendees or the public.
No new questions. Thank you.
Okay, great. In that case, we can turn it over to the discussion and all the input you all were sitting on to provide for this study. I know that Jose had suggestions about the questionnaires. Do you want to start with that?
It was actually about the biomonitoring, the timing of the biomonitoring. So I saw a question there. Well, what's the timing? Should it be spring or summer or fall, or the pre-post filter installation? My thought would be probably focusing on the wildfire season, because that way you'll be more, you'll be able to see more differences, right? Because my understanding is that your objective is to look at the differences between one intervention versus the other intervention, right? So you'd see the biggest difference, the biggest change overall during those high exposure periods, because that's when most of the intervention will really be most effective ultimately. So my thought was, I like the idea of having the pre-post during the wildfire season. So then you can compare how much change there was across both of the treatment groups during a period of high exposure. And then, I guess that would be my initial thought and recommendation.
Thanks, Tom.
Yes, I guess I have a thought about like locations, and maybe you've already thought this through, but if it is through the questionnaire or a survey, because you made an alluded to the fact that some people use the swamp cooler only in like a bedroom or one room, and maybe others have a whole house version. And the same may be true of the filters. They may move it around. I'm talking about the Lavoie type mechanical or the box one, but I don't know if through the questionnaire you can elicit like exactly where the effect is going to be. So if somebody has a swamp cooler only in their bedroom, they may not get a lot of benefit. And you probably will see that with the purple air, depending on where it's located. But I'm just wondering if you're going to use the questionnaire to get a sense of where people are locating the air cleaning, or where the air cleaning effectiveness will be targeted, like more whole house in some cases, more single room, and how you might elicit that. I mean, something to think about.
Thanks, that's a good question. The swamp coolers that we saw, every single one of them went to the sort of a common room. You know, often it was sort of a combined living, dining, kitchen area. And so we didn't actually see any swamp coolers that went to bedrooms. And then it was not unusual for some of the bedrooms to have window air conditioners, though that was not true in all the homes. So we, you know, that's a particular other variable. We have schematics of all the homes with the locations of the swamp cooler outflow, the location of the purple air, and whether there are other cooling, you know, like in a window AC. Since the swamp coolers were all in the common room, all the purple airs went into the common room area as well. Trying to put them as far from the kitchen area as possible, but since these were small spaces, we are picking up a lot of effect from cooking. So something we're
Yeah, if I could just follow up, because the cooking was another issue about, I mean, I watch purple air in my neighborhood, and it's really amazing. At mealtime, there are houses around here that'll go off the charts. Even when the outdoor air quality is 15 or whatever, really good, and then you'll see the indoor ones at night just jump. And because some people are really, as soon as you start frying foods, so depending on how they cook foods, it's going to send the purple airs right off the chart. And I guess you can at least watch for that, or ask them what they cook, because it really is dependent on how they cook their food. And if they're frying things, if they're using cooking oil, high temperatures, they're just going to be generating, they're going to get up to 150 without much effort.
Yeah, that's definitely true. And a minority of the homes had stove hoods that functioned. So, and that is something that we see in our data. We do see cooking effects, and we're trying to correct for that. And it is going to be an issue potentially with the biomonitoring that we're also thinking about. I'm not quite sure how to solve that.
I have a quick question, and then I'll get to Ulrika next. Will you remind me what your assessment is of outdoor exposure? There was timing of urine collection that was meant to capture exposure outdoors as opposed to exposure indoors. Can you remind me what that was?
So one of the possibilities that we've talked about is doing morning and evening. So actually the opposite, evening and then morning. So doing after a work day, collecting urine sample that could then actually potentially be frozen in that person's home freezer overnight. Get a first thing in the morning sample after the person has been, one hopes receiving the benefit of the air quality intervention overnight, and then pick both up and freeze them at -20 shortly after that. So that would be one approach. And that could be done, before any wildfire event happens to sort of capture baseline potentially. And then maybe during a wildfire event, of course, we don't know for sure if or when we would have a wildfire. And but if we do, then obviously that would be perfect way of maybe getting that sense of where people are getting their exposures. And then the other option would be to look just before and just after we install the filters. Then the question is, are we installing during a wildfire event, or are we installing just sort of on a perfectly nice day, at which point we might not see very much. So there's a lot of things we're struggling with right now as we refine the design.
Thank you for that. I'm very intrigued by the idea of collecting, if you're looking at farm workers, and or I support, if you're having any difficulty with recruitment, certainly including other outdoor workers. I think it's very intriguing and potentially very useful from a public health standpoint to be able to catch that evening urine followed by morning, because the intervention in this study, of course, is in the home, but that could potentially generate really useful data for other kinds of interventions. I'm sure you're aware of the work that Cal OSHA is doing around a respiratory protection standard for wildland firefighters, and for that, it's a technology forcing regulation, and there's developing PAPRs that are appropriate and usable by firefighters in wildland settings and the WUI settings. And the idea that ultimately, like gathering data on outdoor exposures for farm workers could potentially inform a similar kind of standard for agricultural workers who have to work during wildfires or something. It's tantalizing, the idea that you could generate a little bit of that data that's not specific to the intervention here, but might also be really meaningful from a public health perspective.
I think that idea is great, and although definitely separate from the project. And I just want to clarify that being a farm worker is not a criteria for participation. It's just basically the type of swamp cooler that they have, a swamp cooler that is functioning and all that. However, the reality is that a lot of the people who live in these homes that we're recruiting, that's their main occupation, but it's not the only one. And we are not, necessarily saying you have to be a farm worker for them to participate.
Great. Thank you so much for that. Ulrika.
Yeah, so I have just a kind of a comment and question about the questionnaire, and sort of related to what Tom was talking about with the, cooking as a source of PM pollution inside the home. In your questionnaire, are you going to be asking about, especially if you're doing, to try to get a sense of what other exposures, might be. I noticed that there was like a barbecue grill, I think, in one of your photos. If I was, are you going to be asking kind of about use of those devices, around the time when you were doing the sampling, fireworks, people like to set off fireworks, things like that, that might contribute to, PM readings maybe in your, well, I guess you don't have outdoor ones everywhere, right? You said you just have them kind of distributed in the community. Is that right? So it wouldn't really affect the outdoor readings, but it might affect the indoor readings.
Yeah, we have roughly 3 purple layers distributed around each of our communities, so it's not at every home. Yeah, we ask questions about burning candles, burning incense. We ask questions about smoking sort of beyond the recruitment, making sure that there's no smokers in the home. And then we definitely asked questions about and tested people's stove hoods if they had stove hoods. We asked about whether they use them. But we didn't ask, and then we observed things like, wood piles, outdoor tortilleras, because there were people who actually obviously would, cook outdoors. And then, yeah, and barbecues and things like that. So that's all. We didn't think of fireworks.
Yeah.
So
during the pandemic, they became infinitely more popular, at least where we live. So, all right. Well, thank you.
Great. It's just about time to wrap up, but Jenny, I want to get your question or comment in and then we'll move on.
Sorry, I'll try to be very quick. Again, thank you for your answers. I'm just wondering for the questionnaire, if you ask about cleaning, either behaviors or equipment, like do these sweep with a broom? We often see a big, huge spike with sweeping, and sometimes vacuums that don't have HEPA filter. Also, pets can also really stir up the air. And so do you ask about pets in the home? Thank you.
Yes, we asked actually, I think about all of those things. We asked about sweeping, vacuuming, pets, indoor pets. Yeah, a lot of the homes had out pets in the yard who didn't come into the homes, but it was, so we realized when we asked about pets in the first questionnaire, we missed that distinction, which is important. So now we're specifying really indoor pets. So yeah, I think we'll be covering all of those issues.
Great. Thank you so much, Nayamin and Gina. It's really fascinating to hear about this study, exciting, and we really look forward to hearing results down the line. Thank you for letting us have a word in as you think about the design of the next phase, and thank you for doing the work. I'll move on now to introduce Stephanie. So Stephanie Jarmul is Acting Chief of the Safer Alternatives Assessment and Biomonitoring section in OEHHA. She'll provide a brief overview of the plan for SGP meetings in 2023, and then we'll have a little time for questions or discussion about that, and then some open public comment period before we adjourn. Thanks, Stephanie.
Thanks, Meg. And just 2 quick points before I get into the presentation. This presentation and discussion will likely be very brief, so we could always go back to the discussion of FRESSCA if there's some pressing questions you may have. And also today won't be the last opportunity for discussion, as you'll be hearing more from the Biomonitoring California team next year after we figured out some of the details that we've discussed today. And I'll go share my screen. Okay, can you see my slides?
Looks good.
Okay. So I'm just going to briefly discuss our plans for next year's scientific guidance panel meetings. You'll see that we've worked with the panel to select the following dates and times. That will be Tuesday, March 7th, 10 a.m. to 1 p.m. So in the morning. Friday, August 21st, 1 p.m. to 4 p.m. in the afternoon, and then Monday, November 6th, 1 p.m. to 4 p.m. And the Bagley-Keene exemption for having meet in person has been extended until July of next year. So we will definitely hold the March meeting via Zoom webinar, and we'll make a decision on the meeting format for August and November after further internal discussions and factoring in any potential new language around Bagley-Keene that may be introduced before next July. You'll also notice that we will be continuing with the half-day meeting format as we discussed in November of last year, though we can always extend the meetings as needed. Similar to this year, our standing agenda will include a program update, which will include an update on our community biomonitoring studies and an opportunity for discussion and input from the panel and audience. There are other potential topics of interest that we have planned or could consider exploring. For the March meeting, we'll actually be hearing from Matt McLeod from the Stockton University in Sweden. On his application of, Stockholm, I think I said Stockton University in Sweden, on his application of a population-based pharmacokinetic model to help interpret the PFAS data from CARE. That'll be happening in March. The program will also report back on our progress regarding the PFAS definition that we discussed, I believe, at the July meeting or in March, and we'll be discussing that sometime later next year. And we could also consider a discussion of the recently published National Academies of Science guidance regarding the PFAS testing and clinical follow-up. and potential implications for state biomonitoring programs. Other topics of interest that we could consider exploring include expanding the program's capacity to biomonitor for pesticides, prioritization and development of laboratory methods such as non-targeted screening, and how to better address climate change through the program's activities. And as always, we welcome any input from the panel and audience on these items and additional topics we should consider. So I'll stop there and see if anybody has any questions or suggestions about this plan, either from the panel or the audience. If that all sounds good. Jenny?
Jenny, yeah, go ahead. Sorry.
Is this a good time to suggest additional topics?
Sure.
Oh, I just remember, and perhaps it's just me not following the literature, that we were very excited about measuring metabolites of 1-nitropyrene in urine as part of the various studies. And there was some debate at the time about differential levels in children versus adults and kind of best practices around that issue and how to interpret the levels. And I just think it's so exciting if we could show the effects of the clean diesel programs by CARB, really show a public health benefit that I personally like to see more regarding this biomarker and the data collected and interpretations of it as a suggestion.
Thank you. Any other suggestions or questions?
Jose, that's fine. Yeah.
Yeah, hi, Stephanie. So with regards to the biomonitoring for pesticides, are you tell me a little bit more about your interest in that regard. You want to know which ones to potentially be adding, or what's the question, I suppose?
That is part of it. And if the chemicals are currently on our designated list, the ones that are currently being used in California, we know that there is a lot of interest, especially through the AB 617 communities. That's a very common pollutant of concern for these communities. So it's certainly something we want to look into, whether we have the pesticides that they're using on our list, and if not, should we add them? And if we have them, do we have the methods to monitor for them?
Got it. Okay. Yeah, I mean, making sure that I think the program is monitoring indeed some of the most commonly used pesticides, but across all the different kinds. I think for a lot of areas, the monitoring for insecticides have been, some of the most commonly included, then followed by herbicides, but not really much with fungicides. So it would be nice to kind of dissect a little bit the list that you have right now and seeing how much of each class really are being measured. And of course, within each one of those, you have a lot of different subclasses, and that's the whole topic. So I think like the discussion for biomonitoring of pesticides will require a good amount of work.
Definitely.
Any other questions or comments for Stephanie and the program on priorities and upcoming meetings and things you'd like to hear more about?
I have a question about, so then the format is one of the things that you mentioned, whether to keep it. So it sounds like for August, it would still be a virtual meeting. And is that what I understood? And then defining later on what the next, how it should be in the future?
Yes, so, and that's really because of the Bagley-Keene exemption, so of having to meet in person. So that is set to expire in July. So we need to have some more internal discussions within OEHHA to figure out what direction we're going to take if and when that exemption does expire. So that's why it's still TBD for August and November, if we might have a hybrid version like we did in July or some other policy.
Okay. Thank you.
Ulrika.
Yes, sort of related to your biomonitoring for pesticides, and I agree that is something that it would definitely be worth pursuing, and especially possibly pesticides that are not currently already being biomonitored under the program. But related to that, thinking about maybe doing biomonitoring for pesticides in the context of occupation and doing some occupational study around that, because I think that's something that I know in the past the program has done some occupational studies, but I think it would be useful to incorporate that into some of the future planning that you're thinking about. And that might be one area in particular where it would be really interesting to do biomonitoring for pesticides.
Maybe I could just check and see about public audience questions. This moment. We'll go to the open public comment period in a minute, but if there's any email or webinar questions from attendees.
No new questions. Thank you.
Thanks, Cheryl. Anything else from the panel on what you'd like to see in the coming year? I know that the program is happy to take this kind of input at any point, but this is just sort of one focused moment where we have the opportunity. In that case, maybe I will go back to the sort of open the public comment period. We have 15 minutes allotted. Thank you so much, Stephanie, for the presentation. We have 15 minutes allotted for the open public comment period, and this is really intended for any topic related to biomonitoring California. And webinar attendees can speak up by using the raise hand function, or by submitting written comments via the Q&A function of Zoom, or by email to biomonitoring@oehha.ca.gov, and we'll read them out loud. So I see we have a raised hand from Jarmul. Go ahead, please.
Hi, this is Jarmul. I'm one section, and I'd like to follow what Dr. Rika mentioned about monitor occupation exposed to the pesticide. I do remember when our laboratory started almost 12 years ago. The first project we tried to do is monitor pesticide, organic phosphopesticide exposure in the Tulare County. And at that moment, we do not have full capability to monitor multiple biomarkers. I think today program already developed at least OP pesticide, multiple metabolites. Also monitoring occupational exposure might be easy to explain if any biological health effect exists. For general populations, very hard to link the exposure levels, even we find it with a specific health effect. So I really like that idea for program to consider in the future round of study, consider occupation exposure included this pesticide proposal. Thank you.
Thank you. Anyone else in attendance, or is there anything on the email forum? And when are you raising your hand again, or is the If so, you're welcome to unmute and speak. Oh, you're still muted.
Actually, I'm done. I'll try to lower my hand. Sorry.
No problem. Stephanie, if there's,
Actually,
oh, go ahead, sorry.
I do see a hand raised from Clay Larson. So Clay, I'm going to give you permission to talk, and you'll likely have to unmute yourself.
All right. Thanks. First, I'd like to note I've really enjoyed the presentation. We may be doing a presentation soon, and I've talked to Stephanie several times. You guys set the bar a little pretty high for in terms of the being able to duplicate the feeling of a real meeting. I'm impressed. We don't have Zoom, so we're a little disadvantaged. I did have a question, and I checked a number of years ago. There's an couple agricultural chemicals that are designated, Zeranol and Trenbolone. As of a couple of years ago, there was no plans for monitoring those. I haven't checked since. As far as the panel knows, there's still no plans for monitoring, and these are additives used with beef cattle. Trenbolone is an androgen. It's legal in the United States. It's not illegal. It's not legal in Europe and many other places in the world, but it's legal in this country. And so, does any of the panel know of any plans to ever look at those chemicals?
And sorry, Claire, are you talking about plans to biomonitor for them within our program or external?
Yeah, I mean, they are designated chemicals in the biomonitoring program. But as far as again, when I checked a couple of years ago, there was, I would say, no interest in, no plans for actually monitoring those chemicals. But I haven't checked for several years.
Nerissa, did you want to say something?
Yeah, I guess I would just comment that there are many more chemicals on our designated and priority list than we actually have laboratory capacity to measure. There unfortunately are many chemicals of interest that we recognize as being important to monitor, but our capacity is limited. And so it's a matter of trying to focus on what are the most pressing things or the priorities for our program at the time within that limit.
All right, thanks.
Thank you. And Stephanie or Cheryl, one last check if there's anyone I'm missing on the webinar or anything on the OEHHA email that we should catch. Okay. Hearing nothing. Thank you so much for that. Stephanie, do you want to weigh in on the question of we have 10 minutes of people's time that we could use. Should we adjourn now? Or did you want to return to the previous discussion? It seemed like that discussion had maybe wrapped up. But maybe I could ask the panel if anyone has anything burning. Looks like Oliver has something he could say. And then I guess I'll open it back up to the panel for a moment. And we have until 4 o'clock if anyone has anything that didn't get aired. Oliver, go ahead.
Yeah, I had wondered, there was something announced on the agenda of a declaration of emergency, Hunters Point Biomonitoring Foundation Incorporated. What happened to that? Is that?
That was a public comment that we had received via email, and we have posted it to our webpage.
Okay, so that's all that happens?
Correct.
Okay, I thought somebody wanted to say something. Okay.
Any other questions or comments from the panel members that we didn't get to? In that case, I will make the couple of announcements that I need to make before we adjourn and we can finish. The transcript of this meeting will be posted on the Biomonitoring California website when it's available. The next SGP meeting, as Stephanie mentioned, will be on March 7th, 2023, and that's from 10 in the morning till 1 p.m. Attendees can join via Zoom webinar like this one. And with that, I want to thank the panel. A big thank you to the staff and our guest speakers who made the meeting what it is today, and also to the audience who attended. And I'll adjourn the meeting. Thank you very much.